So asthma is a very interesting disorder. We use the term asthma to cover a lot of different things and a lot of different triggers that cause similar symptoms in children. So sometimes people's asthma can be triggered by pollen. Sometimes people are more triggered by viral infections or airway irritants or things like that. Those are probably the most common things that trigger people's asthma. And then we use similar medications regardless of what the trigger is to help control their symptoms better. I typically see a couple of kids every week who are coming in to be evaluated for exercise-induced asthma, and those patients quite frequently tend to only have symptoms when they are exercising. And we do treat that slightly differently than we do other types of asthma. It's less responsive to the type of controller medicines we use to help prevent symptoms in kids who are more triggered by viruses or pollens or things like that. Part of our initial evaluation with any patient who we suspect might have asthma, it involves a thorough history. Depending on the child's age, we may do pulmonary function testing. That's something that we're not able to do typically in little children like toddlers, but you can do it in 4 or 5 and up. And that helps us get an idea of how well air is flowing through their lungs. And we do that as part of their clinic visit. We also often will do allergy testing as part of the visit to help us figure out what allergens might be triggering a patient's asthma. Our goal for all of our patients with asthma is to live completely normal lives. We would like for them to function as though they have no asthma symptoms, and we titrate our medicines to help us get there. So some patients can get by with just using a medicine as needed, like when they have a cold or when they're exposed to their allergen that causes problems with their asthma, and that's typically albuterol. But other children need a medicine or multiple medicines that they take every day to help keep those symptoms under control. But our main goal is always to control the symptoms as well as we can on the least amount of medication possible. So one of the things that parents notice most often is that when one of their children gets a cold, that it lasts longer than either their siblings or than their friends at school. They'll be coughing much longer. Their cough is harsher, and they often also seem sort of short of breath with that cough. So it's not just a cough and then they go about their business. They're coughing and also working a little bit heavier to breathe. That's usually the first sign that parents will notice and take their child to the doctor for.